If you're dealing with lumbar spinal stenosis and you have that constant back pain or that leg pain, tingling, numbness, and weakness, or maybe sleeping is just miserable, stick around for the next few minutes because I'm going to show you 5 safe and effective core exercises that will help relieve that nerve pressure and pain and allow you to move more freely. Hi, I'm Dr. Rob Bates. I'm a 67-year-old chiropractor and athletic trainer. I have moderate severe lumbar spinal stenosis through the years. I've helped thousands of people with lumbar spinal stenosis, including myself. For myself, I've gone to where I couldn't walk for more than a few feet without having excruciating pain, to where now I can walk miles at a time with no pain at all from the lumbar spinal stenosis, and I have my active lifestyle back. However, before you do any of the recommendations in these videos, make sure you check with your healthcare provider and make sure this is correct for you. With lumbar spinal stenosis, it's a narrowing of the nerve canal that puts pressure on either the spinal cord or the nerves, and that can create those symptoms. So initially, you want to avoid certain types of exercises, and it's going to be extension type of exercises. So anything where you're doing back bends, repetitive back lifts, things like Cobra. Also, you want to avoid full sit-ups or straight leg raises. As you do full sit-ups or straight leg raises, it's going to require a lot of core stabilization, and those exercises have a tendency to put you in extension, and if it puts you into extension, it'll close down that canal and flare up your back. So initially, avoid the extension type of movements along with the hip flexor type of exercises. So the exercise that we want to focus on, however, is going to be more flexion-based type of exercises, because with lumbar spinal stenosis, when you perform flexion, it will actually open up the nerve canal. When you open up the nerve canal, it's going to allow for relieving the nerve pressure, allows it to rest and desensitize and heal as you exercise. So these 5 core exercises that I'm going to give you are very safe and effective, and they're great for beginners, and you can actually scale it to increase the intensity as you go. They're great for strengthening, stabilizing, and stiffening up and creating muscular endurance around that spine, so it will prevent that when you go out and do your activities, or prevent any type of micro slippages or slippages of the spine to where it will create pinched nerves and flare-ups of the lumbar spinal stenosis. So these exercises you can perform daily. Exercises are going to use long hold isometrics. The goal is 30 seconds. You can work your way up to 30 seconds. Typically, you're going to do 30 seconds and repeat it 3 repetitions. These type of long hold isometrics are going to be great for increasing that strength and stability and muscular endurance like we talked about. Also, it creates a lot of stimulation in that soft tissue, in the tendon and the fascia, in a condition called creep. Because as you build up in the time under tension, it will shorten up the muscle, but then it'll allow for more of a relaxation response in the tendon, and it'll disperse the load. So when it disperses the load more, it will actually put load in those areas that have been damaged, to where now it will stimulate the innate intelligence of the body to start laying down collagen in those areas. That means it will regenerate and repair all those weak links around the spine and those tendons and fascia. So long hold isometrics, 30 seconds, and then we're going to repeat it 3 repetitions. First exercise is cat camel. It's not going to be an isometric as much. It's more of a warm-up type of exercise. So you're just going to go cat camel, and you're just going to arch your back here, brace abdominals, and go a little bit of extension, but not just to more of a neutral position. Not going to totally arch the back. So you're going to go in flexion, extension. Do about 5 to 10 repetitions of cat camel, and then you want to hold into this angry cat pose for about 10 seconds. Next exercise is going to be abdominal curl-ups. Abdominal curl-ups, you want to brace abdominals like you're getting hit in the stomach. You want to make a fist. You want to curl up forward like this. You want to hold this for 30 seconds. You're going to repeat this 3 repetitions. Next exercise is going to be the lateral plank. So you start off, you want to brace abdominals, stiffen up that core, bridge up on that lateral plank, and hold this for 30 seconds. And you're going to repeat 3 repetitions on each side. Now we can scale back down. If this is too hard, all you have to do is bend your knees, brace abdominals, and bridge up from the knees, make a fist, and reach up into the sky. The reason why I want to reach up into the sky is because we don't want you to be curled up and you want to keep the shoulders in alignment. So hold this for 30 seconds and repeat it 3 repetitions on each side. If you're having a lot of problems with your shoulders while doing the lateral plank, do this type of exercise instead. Get a pillow or roll up a towel so you can lie on your side so it'll fill the space between the shoulders and your head. So your neck doesn't get kinked. Straighten out your legs, brace abdominals like you're getting hit in the stomach, lift up together, hold that 30 seconds, isometric contraction. Repeat 3 repetitions on each side. You're going to really feel it in that QR, the obliques, the psoas muscles, and it's really going to help strengthen and stabilize this area. 4th exercise is going to be the bird dog. You want to brace abdominals and don't arch the low back. Keep it neutral. You extend the leg out, point the toe towards your head, make a fist with that diagonal opposite hand, reach out and extend. Hold this firmly, 30 seconds, repeat 3 repetitions on each side. You can scale that to where all you're doing is you brace abdominals, keep that neutral, flat back, and just lift the knee up a little bit. So as you lift the knee up and lift the hand, let it hover off the ground a little bit. Hold that for 30 seconds, and then you want to repeat, switch, and go to the next side. 5th exercise is the glute bridge. Brace abdominals, lift the toes up, dig those heels into the ground, contract the glutes. Don't arch the low back, keep it neutral, and hold this for 30 seconds and repeat 3 repetitions. Now, if it's too easy, just go ahead and lift and do a one-legged glute bridge. So you just bridge up into one leg, hold that, point that toe towards your head, hold it for 30 seconds, repeat 3 repetitions on each side. People with lumbar spinal stenosis, one of the major things that wrecks their life is their inability to walk or stand for long periods of time, just like for myself and a lot of my patients. So this next video is going to show you exactly what I did in order to get back walking for miles at a time with no pain with the lumbar spinal stenosis, along with getting back my active lifestyle. Also, you should realize that everybody's lumbar spinal stenosis, the way it expresses, is going to be different, and there are different needs. You may have some specific questions that you want answered, so make sure you comment down below so in the future we can maybe make some videos specific for those topics. Other people are going to need your help because there's people out there that don't know this information. They're really suffering their lifestyle with these type of symptoms of lumbar spinal stenosis. So spread the word, give them this information, share it with them so they can benefit and potentially change your life and get back their active life just like myself. Make sure you subscribe. And we really appreciate serving you. Keep spreading that word. We'll look forward to seeing you on the next video.